Hi, I am Peter Gloviczki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery. The March issue of the JVS is packed with excellent manuscripts. The Editor's Choice article this month is the long-awaited reporting standards for type B aortic dissections, authored by Dr. Joseph Lombardi and colleagues from the Society for Vascular Surgery and the Society for Thoracic Surgery. Now, this SVS-STS document clearly defines the main acute aortic pathologies, like aortic dissection, intramural hematoma, and penetrating aortic ulcers. It also defines the main categories of high-risk aortic dissections and the two main complications, rupture and malperfusion. Aortic dissections can have hyperacute, acute, subacute, or chronic presentations. The document recommends a new classification system where type B dissections include now those that originate in the aortic arch. The new classification includes anatomic reporting that defines the location of the entry tear and the zone of the distal end of the dissection. Please study this document carefully and adopt the new standards of aortic dissections for your clinical practice and for reporting your results. The next article I would like to present is our CME article this month. It is entitled Incidence, Natural Course and Outcome of Type B Endoleaks in Infrarenal Endovascular Aneurysm Repair, based on the ENGAGE registry data, authored by Dr. Martin Dijkstra and colleagues from the Netherlands, Canada, Germany, Belgium, Spain, and France. In this retrospective review of 1,263 EVAR patients, the 5-year incidence of isolated type 2 endoleak was 15.6%. 11% of these patients developed a late type 1 endoleak, and the 2/3 of these patients needed secondary intervention, and this group also had a significant risk of aneurysm-related complications. Another article I'd like to highlight today discusses limitations of resting ankle brachial index in the diagnosis of symptomatic peripheral arterial disease. This was written by Dr. Ali Aburama and colleagues. This is a critical analysis of 2,226 ABI exams and 1,383 duplex ultrasound scanning to determine if a resting ABI is sensitive enough to detect a 50% or greater stenosis in any of the main lower extremity arteries in patients with symptomatic peripheral arterial disease. Now, resting ABI had a sensitivity of only 57%, with an overall accuracy of 74%. The sensitivity was lowest in diabetics, 51%, and in patients with chronic kidney disease, 43%. This sobering study found that 43% of symptomatic patients with a 50% stenosis or greater on duplex ultrasound had normal or inconclusive resting ABIs, with even higher numbers in diabetics and in those with chronic kidney disease. The fourth article is a multi-institutional study written by Nicole Rich and her co-authors. It's on long-term freedom from aneurysm-related mortality after EVAR in a 15-year multi-center registry. The crude aneurysm-related mortality at a median of 5.5 years after 1,736 EVAR procedures was only 3.6%. Delayed rupture occurred in 1.3%, and major reintervention was needed in 10.3%. So these data support EVAR as a safe and long-term solution for managing patients with abdominal aortic aneurysms. The final article highlighted this month is entitled "The Incidence and Risk Factors of Stent Fracture in Patients Treated for Proximal Common Carotid Artery Stenosis." This was written by Dr. Miklós Vértes and colleagues from my alma mater, the Semmelweis University in Budapest, Hungary. In this retrospective review, 70 patients underwent proximal common carotid artery stenting, and during a median follow-up of 76 months, the authors noted fractures in 39% of a variety of stents that they used. The only significant predictor of stent fracture was vessel calcification. Interestingly, there was no significant difference in patency nor in reintervention between those who had fractures and those who did not. There was no difference in primary patency, and there was no difference in reintervention between the groups. These were just 5 of the many excellent papers from the March issue of the JVS. They are free for you to read until the end of April. Please follow us on social media and remember to like, comment, and share. Thank you for watching, and see you next time for the highlights of the April issue of the Journal of Vascular Surgery.